Hi, I am Aral Sürmeli. I am the co-lead of Project HERA and a medical doctor from Turkey. Since starting medical school, what excited me the most was public health and how we can improve the health of vulnerable communities around the world. I co-founded the first medical rescue NGO in Turkey, Medical Rescue Association, and since then have been working in the field with people who are affected by humanitarian crises. What motivated us to create HERA was our experience with the refugees in Turkey. A couple years ago, while I was working as a physician in the ambulance system, we received an emergency call from a pregnant refugee woman. She was due in 2 weeks, but she had bleeding. As I examined her on the way to the hospital, I realized it was too late for the baby. What was worse was that knowing that it could have been prevented if she had been to pregnancy checkups. This risk could have been found and prevented. Stories like that, stories where a refugee child has a seizure because of a vaccine-preventable disease in the middle of Istanbul, happen far too often. So we created HERA, a mobile platform. Our objective, in the simplest form, is to increase demand for preventive health interventions, such as vaccination or pregnancy checkups. We do this through a unique combination of behavioral nudges. We send reminders for doctor appointments, provide information, and direct them to the nearest healthcare facility. Team HERA is made up of people who want to use available technology for the health of people, especially people who had to flee from a war or a disaster. We aim to decrease animal deaths, vaccine-preventable diseases, and pregnancy complications, diseases that we do not see much in the more developed parts of the world. Our shared vision is that HERA can be used for many populations around the world who are forced to leave their homes by cooperating with international organizations such as UNHCR and the World Health Organization. Team HERA includes people from Turkey, Syria, Lebanon, US, and Canada. While one team is working in the field with the population directly, another team is in US, developing the project and networking with international partners. This is why we believe that Team HERA is in a unique position to effectively address the demand gap in the healthcare access of refugee populations. Thank you.